If you enjoyed the video, be sure to like and subscribe.
Hey guys, Dr. Anis Kassab here, coming to you guys again from Triforce MMA, the best MMA gym in the state of Rhode Island, okay? I'm also a chiropractor. I work right around the corner in Central Falls. If anybody is interested, check out D. Crescenzo's Chiropractic in Central Falls for any type of chiropractic care, okay? Today I'm going to be going over mid-back pain and some strategies that I utilize for mid-back pain for all of my grappling. Now, this will work if you're, somebody who works on a computer all day, or if you're somebody that just has mid-back pain, you're not so sure why it's happening, and it'll also definitely work for a lot of you grapplers out there. So what ends up happening is with the mid-back is 9 times out of 10, it's from having a rounded posture going forward, okay? So a lot of people who are carrying heavy things all day, like a lot of people who work for companies like FedEx or UPS that are always carrying heavy boxes, they end up getting some pain in their mid-back, okay? And also grapplers end up getting it because we're always rounded forward here whenever we're in the guard position. We're always looking to hook our opponents, rock back, come up. We're always moving with rounded shoulders. And oftentimes it can create some strain on these muscles back here, and also it'll keep the joints not operating the way that they should be, okay? What we want to do instead is promote this kind of a posture where we're a little bit more upright, okay? We never want to be super far rounded forward. Right? So what I like to do to try to prevent a lot of the pain that I get in my mid-back from jiu-jitsu related activities is using these 3 strategies. The first one is with the foam roller. I like to get the foam roller on the ground, heels down. Mid-back goes right up against the foam roller, and I'm going to give myself a big hug here. What the hug is going to do is it's going to open up my shoulder blades and it rounds my shoulders forward a little bit so I can expose all of those muscles. And now I'm going to start off by lying down low on my mid-back and rolling all the way up almost to the base of my neck. Now, when I go all the way down low, I'm rounded forward a little bit more. As I go all the way back up, my back extends a little bit more. Forward and backward. I'm pushing into the ground with my heels. That's how I'm able to create the mobility to go up and down my spine and massage these muscles that line my middle back, okay? That's strategy number 1. Another strategy that I like to use is rotations. So the thoracic spine, which is your middle back, is primarily responsible for turning our bodies left and right. But oftentimes we don't mobilize this kind of position or train this position or make this any better or any stronger. So I like to utilize this technique here to try to help with that. I get in what I call a quadruped position. I'm on my hands and I'm on my knees. And now what I'm going to do, take one hand, loop it underneath, and have a big turn. I'm trying to fish my hand all the way through to the other side, and I'm even turning my head and neck over towards the ceiling at the same time. I reach, big stretch right over through here, and then I turn completely and go up towards the ceiling, big stretch right up over here, training all those muscles that are helping me to twist my spine. Going all the way down and all the way up. All the way down, all the way up. Another style of this technique that you can utilize is with the hand on the back of the head, and we're going to perform the same motion. Down, up, down, up. Okay, guys, so for that technique, I like to utilize usually around like 10 reps. If I'm just doing a quick warm-up before class, I'll utilize maybe 5, but you'd want to get your repetitions in. And on the foam roller exercise, I like to utilize that for about 30 seconds to a minute. Just really give myself a chance to break down that muscle tissue. Now, the last one is my personal favorite strategy for mid-back pain. This one, if you don't really have great thoracic mobility and ability to move your thoracic spine forward and backward, this one can be a little bit tough, but I definitely recommend that everybody at least tries it a little bit. Just don't force anything that's not there. We're going to take a bar. I want you guys to hold the bar so your arms are straight up and down. I don't want the arms out here. I don't want the arms in close, okay? Straight up and down. Elbows are going to go on the massage bed or bench, whatever you guys have available for yourselves. And what I want you guys to do is dip your head down in between your arms. Big contraction in the muscles of the upper back, and then come back up. Big contraction in the muscles of the upper back, and then come back up. I'll do this a couple more times. Down, big contraction, big extension in that back, then come back up. All right, guys, well, like I said, this is my strategy for mid-back pain that I like to utilize. That last one's my personal favorite. It gets the muscles back there really nice and strong, and it mobilizes your thoracic spine, okay? So try to utilize these 3 techniques to prevent mid-back pain or to even get rid of it in some cases. And as usual, if the pain is not going away, it's been a little bit more than 2 weeks and it's severe, definitely go and see some type of physical medicine provider, a physical therapist, or a chiropractor. All right, guys, thank you so much. Talk to you soon.